Welcome to The Explainer. Today, we're going to decode a term that can cause a whole lot of anxiety when it shows up on a mammogram report: calcifications. You've probably heard of them, right? Or maybe you've seen them mentioned on a report. But what are they really, and what do they mean? So let's get to the bottom of what these little spots actually are. So at their core, they're just these tiny specks of calcium that are dense enough to pop up as white dots on an X-ray. But, and this is the important part, just seeing them doesn't automatically mean something is wrong. It really is all about the details. Okay, so radiologists have this system. They basically sort these spots into three main flavors, if you will. This helps them figure out what's going on and what, if anything, needs to happen next. So let's take a closer look at each of these, starting with the ones that are nothing to worry about. All right, first up, let's talk about the false alarms, the spots that aren't even in the breast tissue to begin with. These are the imposters. You know, stuff you put on your skin, like deodorant or zinc oxide ointment, can actually show up as bright white specks. Same thing with tiny little metal fragments that might be left over from a past surgery. Radiologists are pretty slick at catching these, though. If the specks don't move around when they take different X-ray pictures, that's a huge clue they're on the skin, not inside the breast. Okay, moving on. Let's get into the most common category by far: benign calcifications. And benign means not cancerous. Honestly, these are seen all the time. For most people, finding these spots is just a totally normal part of how the body changes over time. Take vascular calcifications. These are super common, especially as we get older. It's really just calcium building up in the walls of the blood vessels inside the breast, kind of like what happens in other arteries in the body. And the clue here, the classic pattern that radiologists look for, is what they call parallel linear calcifications. Just picture tiny little railway tracks. They perfectly outline a blood vessel. When they see that, it's a total giveaway that it's nothing to worry about. All right, this next one has a great name: popcorn calcifications. And they look just like they sound. They're linked to a really common non-cancerous lump called a fibroadenoma, especially when it starts to break down over many years. This is just a perfect example of how radiologists work. It's all about visual cues. When they see these big, coarse, lumpy calcifications that look like, well, popcorn, the very first thing they think is, degenerating fibroadenoma, a completely harmless process. Next up, we have secretory or rod-like calcifications. These are literally solid rods of calcium that form inside the breast ducts. You usually see them pop up many years after menopause, when the ducts start to shrink. And again, it's all about the shape. They're described as looking like little cigars or large dashes, sometimes with a clearer center, and they tend to point right toward the nipple. Pretty easy for a trained eye to spot and flag as benign. Okay, what about eggshell or dystrophic calcifications? Well, these are basically the body's way of healing from some kind of past trauma. Could be an injury, a surgery, or even radiation therapy. Think of them as a type of scar tissue. And here's another awesome buzzword for radiologists: lucent-centered. This is because the calcium often forms a ring around an area of damaged fatty tissue, what doctors call fat necrosis. The result? It looks just like a hollowed-out eggshell, another clear sign. Okay, this one is really cool. It's called milk of calcium. And what's so fascinating is that its appearance actually changes depending on how the patient is positioned for the mammogram. It's basically teeny tiny calcium particles just floating around in fluid inside a small cyst. So check this out. When the mammogram is taken from top to bottom, the particles look kind of hazy and spread out. But when the picture is taken from the side, gravity does its thing. Those little particles settle down into a flat layer at the bottom of the cyst, and it creates this super distinctive teacup sign. It's a classic textbook benign finding. All right, so we've covered the harmless ones. Now let's shift gears and look at the patterns that do raise a bit of a red flag. These are the ones that need a closer look because they could be associated with an underlying cancer. So radiologists get really specific here, looking at the shape and size of every single speck. You've got amorphous ones, which are kind of vague and indistinct, like powdered sugar. Then there are coarse heterogeneous ones. They're chunkier, with dull edges. And finally, fine pleomorphic calcifications are small, they come in all sorts of shapes, and they're sharp. I love the way the source material put it. If you could pick one up, it would actually poke you. Size is a huge part of the puzzle. These coarse heterogeneous calcifications, for instance, are generally bigger, a bit more substantial. We're talking more than 0.5 millimeter. But the fine pleomorphic ones, they're the opposite. They're much smaller, more delicate, less than half a millimeter. And it's that combination, being small, sharp, and varied in shape, that makes them a more concerning feature.
Okay, so here's a really crucial point. It's not just about the shape of the individual specks. How they're grouped together, their distribution, tells a huge part of the story. Think about it like this. If calcifications are just scattered randomly all over the breast or spread out everywhere, that's way less worrying. But when you see them grouped together, maybe in a line or in a triangular shape, that's more suspicious. Why? Because that pattern could actually be mapping the outline of a breast duct, and it might mean something abnormal is happening inside it.
And that brings us to the absolute top of the suspicion list. The number one most worrisome pattern is when you see those tiny, sharp calcifications form in a line that also branches out. It's like they're creating a perfect little map of the ductal system. Now, if that specific pattern isn't there, the next most concerning thing is just seeing a cluster of those fine pleomorphic calcifications. So, knowing the difference between something that looks like popcorn and something that looks like powdered sugar, how does that help you? Well, understanding that there's this incredibly detailed, science-backed system for looking at these tiny spots, that it's not just a guess, can totally change how you feel. It can take that anxiety and turn it into empowerment and help you ask smarter questions and have much more informed conversations about your own